Hi, I'm Dr. Robert Gregg,
And I'm Dr. Dawn Gregg with Millennium Dental Technologies.
live from the Anaheim show of the California Dental Association. And we're here to talk about some of the exciting things that have been going on with Millennium Dental Technologies. One of those, if you haven't heard about LANAP, laser-assisted new attachment procedure, has been cleared by the FDA for true regeneration, true periodontal regeneration. It's the holy grail of healing events in the periodontal treatment, moderate to severe. So we're taking on the most advanced cases of periodontal disease and turning these teeth into teenagers again. And we're the only company that has done extensive amounts of research and science to support our FDA clearance, and our clearance was based on science. And no doubt there will be other companies that get copycat, counterfeit, fool's gold kind of clearances, but they're not the real deal, because FDA tends to rubber stamp clearances once pioneers have received the arrows in their back and paid millions of dollars to get the research done. So we're very excited about that. And because of that, and an innovation we developed within our PerioLase MVP7, we were issued a brand new patent just this past April in 2018. So we have another 20 years of patent protection on the protocol that if you are doing LANAP and you're not under license, you could be in trouble. Not with us, perhaps, but you could be in trouble with attorneys and state boards. There has been enforcement action at that level, and we're more observers than we are participants. So we're more cautionary in our tone than we are in any other way.
And a priority date going all the way back to 2016.
That's correct. Our priority date of the patent was 2016, before the first patent ran out. So we have coverage that's overlapped now for a good 40 years. So we've been doing our homework. We've been being very diligent, and we're all very excited about that. We also have a new patent issued for LAPIP, laser-assisted periimplantitis treatment. It's the only periimplantitis treatment that has a success rate of over 90%. Most periimplantitis treatments are 50% or less, and usually involve opening up a large flap and ultimately not looking so good and maybe not healing so good. So we have documented success rates of over 90%, and we're pretty excited about that too. Human histology coming in the near future. And I think it's important to understand the difference between the FDA clearance process for a pioneer and those that get imitation clearances. And that all wraps up into what sort of training do you get. And I'd love to have our training director and the love of my life talk about our training program for LANAP, LAPIP, and the value-added procedures that go along with the PerioLase MVP7.
I'm happy to talk with you about that. So we have a separate corporation, it's called the Institute for Advanced Laser Dentistry, that is responsible for the training and the research that is provided for Millennium Dental Technologies, which is the manufacturer of the PerioLase MVP7. Now, the Institute for Advanced Laser Dentistry, or the IALD, utilizes certified instructors that have been standardized and calibrated in teaching LANAP and LAPIP. And we have over 50 certified ILD instructors, also including those instructing in the Navy, the Army, and in multiple universities. Now, the ILD provides live patient training, so you're not standing over the shoulder of a doctor, you're not watching somebody else do it, you're actually treating patients with our hand on your hand during the critical steps, so that it gives you the muscle memory and the confidence to go back to your patients and treat them well. We have a motto in the company, and that is, it's all about the patient and the patient comes first. And that's why we have such pride and importance with our training program. In fact, it's such a highlight for our doctors that I think they're floating on cloud 9 by their second day of training, when they've actually treated patients and then they see them back the next day and see how wonderful the results are and how happy their patients are. It gives them a great deal of confidence. They come back 6 months later for another live patient experience, and 6 months after that for 5 days over a year to be trained and get your clinical questions answered. In fact, we assign mentors to our attendees so that they have instructors, even me as a training director, founder of the company, to answer any questions that should arise. Now, I think that that's all probably why we have such successful customers and happy patients, happy staff, happy customers, so that we've been able to offer a money-back clinical guarantee. I've been practicing dentistry for 25 plus years, and I have never run into a company that stands behind the results so firmly as to give you a money-back guarantee. After over 2,200 customers trained, there have only been 2 that have qualified for that money-back guarantee that felt, well, I think they shouldn't have been practicing dentistry, but that's another story.
Having said that, LANAP is a user-friendly procedure. It's suitable for the GP. It's plug and play, fire forget. There's presets. It's a cookbook recipe. It has 26 specific steps that you must at least evaluate as to how you're going to apply them. So it does require a little bit of thinking and a little bit of experience, but it's not a blood and guts procedure. It's not ripping the tissue off the periosteum. It's a procedure that is a little more nuanced, but it's a lot more patient-friendly. It's the most relaxing procedure that I do. It's 1 quadrant of LANAP is actually a lot easier than a 3-unit bridge, and I would also agree, probably easier than placing some implants that we have to place these days.
And if I could add, it's the PeriLace MVP7 is a laser that was developed by dentists for dentists with a protocol by dentists for dentists. So understanding the problem and then inventing a device that can adapt to the periodontal patient because they don't all look the same. It's safe, it's easy to use, and it was specifically designed to support the LANAP and LPIP protocols, and there are no other laser devices that do that.
Yeah, that's right. Took the words right out of my mouth. Yes, I did develop the LANAP protocol. I did design with my former partner the PeriLace MVP7, and we did specifically fine-tune it, dial it in for the LANAP parameters. Now it'll do a whole bunch of other procedures that good lasers can do, but the moneymaker, the procedure that pays for the laser in the very first patient is LANAP. And we always used to say, why would I buy a laser if it doesn't pay for itself? And LANAP has been the killer app, and it's been such a killer app that companies around the industry, around the world, try to copy us, even use the LANAP name in places I won't say, but other countries, and use devices that was never intended to support the LANAP protocol, but it shows you how popular the concept has developed. So buy from the originators, learn from the authentic innovators, and stay away from the copycat and the fool's gold, and your patients and your regulatory board will be much happier. Did you want to?
Well, I wanted to add that all of the knowledge and the know-how, the trademark, the patents, the device, all exists within Millennium Dental Technologies with access to the brain trust who developed it. And no one else knows how to do LANAP other than those who teach it, and that's what we do.
Yeah.
And support our customers in the process.
I'd like to say that nobody knows more about LANAP than I do. I've done it all, I've seen it all. I know the permutations, the variations, the exceptions to the rule like no one else. So if you're going to learn, who do you want to learn from? Yeah, the source. Go to the source. The others, imitators, they don't know all the problems, nuances, and side effects that could come up, or how to adapt to certain clinical situations. I'm a clinician. I relate to clinicians. We're the only company that has clinicians as owners and founders and teachers, and that's a really important distinction because we relate to the customer, we relate to them, we don't leave them hanging. We're there to support you at least for a year and then beyond. We like to think that you, upon your graduation and your receiving of your fellowship coin, which I left it back at the hotel room, that you're on your way to outstanding proficiency and even greater results, because the results just get better over time. The last thing I wanted to mention is that Millennium is not a company that sits on its laurels and with our own successes. We have new technology we're bringing into the Periolays that will not add to the cost appreciably. It might be a small upgrade charge, but it is upgradable, and that's what's unique about the Periolays, is we can upgrade. Every variation, if you want to call it that, has not required someone to come and buy a brand new Periolay. So we don't have a Periolay 7, a Periolay 8, a Periolay 9. We've made obsolescence obsolete. And we've also got a new innovation that's coming out probably in the fall that will be added and incorporated to the Periolays, which should be additional enhancing, but that's no reason to delay getting involved, because that can always be added in. We also have a new small diode technology. And again, we're not a company that serially invents lasers every other year. So if we do come out with a new product, a new laser, it's unique. And this particular laser, it's called the Blazer with 2 Z's. And that Blazer is patent pending, FDA clearance pending. And we're very excited about it, what it can do for the hygienist and what it can do for the GP especially, but also the periodontist, orthodontist, and some others. So it'll have a great range of applicability at a very low price point, and it will do things no other laser can do.
But not Linnap.
Yeah, it's not a Linnap replacement laser. Unfortunately, we've always looked at reducing the size and price of the Periolays, and it's just the new technologies that are out there that might make it smaller drive the price up even more. So if you can't make it to the show, make sure you look at our website, www.lanap.com.
And if you can make it to the show, we'd love to meet you personally. We're at booth 1621, 1621.
And you can call a toll-free number at 188-49-LASER. Thanks. Thanks for listening. Thanks for watching. Appreciate your time.